So now the recording has started. So I welcome you all to our session on learning objective 3 and where we will focus on understanding how to reduce the spread of infection. This is an essential topic in health and social care because preventing the spread of infection is crucial to safeguarding the health of both the service user and care providers. So, as you all know, that I'm your tutor. My name is Syed Madhuruddin Taj, and we will discuss today on today's topic, the learning outcome 3. And in the meanwhile, if you have any question, then please don't hesitate to ask. And I believe that if any one of you is working in a care home setting or in any health and social care related organization, then we all follow the infection control measures at our workplace. So there are few of the important things which we need to consider in uh, reducing the spread of infection. We have agents of infection in that. So these are the microorganisms that cause infection, and they include bacteria, viruses, parasites, and fungi. For example, bacteria such as um, like which cause like throat infection, and it can enter um, through any uh, wound or through our breathing as well. And similarly, viruses like flu viruses can spread rapidly in close contact setting like care home. So it's very common in a care home. If a service user or a care provider has flu, then it can spread. Then we have reservoirs of infection. So this refers to any person, animal, plant, soil, or substance in which an infectious agent normally lives and multiplies. Um, for example, water can be a reservoir for waterborne diseases like uh, chloria and uh, cholera, and also human carriers can also be reservoirs, such as in the case of COVID-19. And then we have carriers of infection as well. So infections can spread through various carriers such as water and vectors like mosquitoes for malaria or human contact. And also, raw or infected food is another common carrier, leading to foodborne illnesses such as pneumonia. And by understanding these concepts, help us identify where infection come from and how they spread. And it allows us to implement effective control measures. So, are you all are working in a healthcare setting or uh, in a care home or like any field related with any organization related with the health and care setting? Right. Mm. Here we have the key terminologies. So before we discuss deeper into infection control, it's important to clarify some key terms. Like we have infectious disease. So Infectious diseases are disorder caused by organisms such as bacteria, viruses, fungi, or parasites. While many of these organisms live harmlessly in or on our bodies, certain conditions can allow them to cause disease. For example, um, under normal circumstances, E. coli bacteria live harmlessly in our intestine, but some strains can cause severe food poisoning. Then we have contagious diseases. So these are a subset of infectious diseases that spread directly from one person to another. For example, the flu is a contagious disease that can be spread through coughing or sneezing. And understanding these terms will help us differentiate between the various ways diseases can be transmitted, which is crucial for implementing appropriate infection control strategies. And we have to discuss about the differences between infectious and contagious. Right. So infectious and contagious are terms that are used interchangeably, but they have specific meanings. Uh, if we talk about infectious diseases, so these are caused by microscopic germs that enter the body and cause problems. However, not all infectious diseases are contagious. For example, Lyme disease is infectious but not contagious because it is spread through tick bites, not from person to person. Then we have contagious diseases. So these are infectious diseases that can spread from person to person through various forms of contact. The flu is also a good example. It is spread easily through airborne droplet when all infected person coughs or sneeze. And if we understand the differences, then it helps us determine the appropriate precautions needed for each type of disease. Right. So in this slide, we need to discuss about the uh, causes and spread of infection. So we need to explore how infections are caused and spread. Uh, so as we discussed earlier, so we have different kinds like bacteria, viruses, fungi. So we'll discuss them in a bit detail. Right. So we have uh, the first one is bacteria. So these are found almost everywhere, including in and on the human body. So while most bacteria are harmless, some can cause disease. So we discuss that, and then we had uh, viruses. So viruses need a living host to grow and reproduce. They can cause a range of illnesses from the common cold to more serious diseases like measles. Uh, and for example, the influenza virus is spread through the air when an infected person coughs or sneezes. Right. So here we need to uh, discuss about the fungi. So, fungi usually thrive in warm, damp environments, while some fungi are beneficial. Others can cause infections like athlete foot, a common fungal infection that occurs between the toes. And many of us had this fungi infection in our lives, and there are certain over-the-counter medications which we buy on ourselves. And if we ask the pharmacist about the athlete's food, and they can give us some cream and also sprays as well. And we have protozoa. Okay, so protozoa, these are microscopic organisms, and they spread diseases through contaminated water. Uh, as an example, uh, Giardia is a protozoan that can cause gastrointestinal infection when people drink contaminated water, and these are very common in the third world countries. So if we understand the different types of germs and how they cause infection, it again allow us to target our prevention efforts more effectively. Then we have other causes of infection. Right. Again, students, if you have any question, please do ask. Don't hesitate to ask any question. I'll try my best to answer. So if we discuss about the uh, other causes of infection, so in addition to bacteria, viruses, fungi, and protozoa, infection can also be caused by parasites. So, if you talk about parasites, what they have discussed. Right, okay. So if we discuss about parasites, then parasites like roundworms and hookworms can cause infections by living in and on their host. For example, roundworms can cause intestinal infection, leading to symptoms like nausea and diarrhea. Then we have mites and insects. So mites such as those that cause scabies, and insects like head lice can lead to infections or infestation. Um, if we talk about scabies, for example, is caused by tiny mites that brew into the skin, leading to instant itching and a rash. So these additional causes highlight the importance of maintaining cleanliness and taking preventive measures to protect against a wide range of infectious agents. Right. So here we need to discuss about how do infections spread. So um, like there is a uh, chain of um, like infection, and there are 6 stages into that. So if we discuss about it, so infection is spread through a process often referred to as the chain of infection, and the first one in that is pathogen. So right, so the infection starts with a harmful pathogen. Then we have reservoir. So the environment where the pathogen can live, grow, and multiply, such as a person or contaminated object. Then we have portal of exit. So the route by which the pathogen leaves the reservoir, like through coughing or sneezing. Then we have uh, mode of transmission. So how the pathogen is carried to another person, such as through direct contact or airborne droplets. Then we have portal of entry. So if we talk about the uh, portal of entry, so the way the pathogen enters a new host, like through a wound or respiratory system, then we have uh, susceptible host, so a person who is at risk of infection, often due to a weakened immune system. So anyone, any vulnerable person who has a weak immunity, so they can get the infection very easily. So that's why we always being told by the elders that try to eat healthy and we should try to make our immune system uh, healthy and strong. So breaking any link in this chain can help prevent the spread of infection, which is why infection control measures are so crucial in uh, health and social care organization and in the field as well. And right, so here we need to discuss about the uh, importance of preventing and controlling the spread of infection. So, preventing and controlling the spread of infection is essential for many reasons, for several reasons. So, uh, like uh, what it does, then if we ensure that we are uh, following the infection control measures, so then the people will stay healthy. Uh, If we discuss about health protection, then effective infection control protects people from potentially serious or even life-threatening illnesses. For example, proper hand hygiene in hospitals or care homes can prevent the spread of healthcare-associated infections like MRSA. Then we have also mm, right. We have also like some legislation and what it says about the prevention and control of infection. So uh, basically, like the primary role of infection prevention program is to reduce the risk of hospital acquired infection. So as we discuss it, that effective infection control protects people from potentially serious or even life-threatening illnesses. Then we have public confidence. So if we discuss about public confidence, so people need to trust that the environments they visit, such as hospitals or care home, are clean and safe. This is particularly important for vulnerable population like the elderly population. And also, if you have noticed that if you travel in the public transport, then there we see the signs these days that the mm, bus or the tram or the train, like they are um, cleaned or like they got sprayed every night. Like so, they are making us aware that they have tried to control the infections and like any sort of infection like that could harm the public or the vulnerable people. Okay, before we go into that, then we have like legal and regulatory compliance. So there are laws and regulations that mandate infection prevention measures to protect public health. For example, the Health and Social Care Act 2008. So in the UK, it sets out the legal duties for infection prevention and control in healthcare settings. Infection control is it's not just about following procedure, it's about ensuring the safety and well-being of everyone in a health and social care environment. Preventing and reducing the transmission of infectious disease is crucial in ensuring that people remain healthy. So we need to discuss why this is important and what measures can be taken. So the first one we can discuss is public confidence in hygiene standards. So people who interact with social care services need to have confidence in the cleanliness and hygiene practices of these services. So this confidence is critical because without it, individual might avoid seeking necessary care out of fear of contacting an infection. For example, during the COVID-19 pandemic, the cleanliness of hospitals and care facilities became a significant concern for both the service user and visitors. So we need to ensure that cleaning protocols and transparent communication about these practices can help maintain public trust. Um, then, for example, uh, if we discuss about legislation on infection control, so legislation play a vital role in setting the standards for preventing and controlling infections. For example, the Health and Social Care Act in the UK, it outlines specific responsibilities for care providers to ensure they follow best practices in infection prevention. So this might include mandatory hand washing protocols, the use of personal protective equipment, we call it as PPE, and regular staff training on infection and control measures. Then we have the primary role of infection prevention program. So the primary goal of any infection prevention program is to minimize the risk of hospital acquired infection, and this is crucial for protecting not only the patients or the service user but also the employees, health sciences students, any volunteers and visitors who might be exposed to infectious agent. Uh, Here's an example. An effective infection prevention program in hospital would involve regular sterilization of medical equipment, and they have also isolation procedures for patients with contagious diseases and robust hand hygiene practices among the staff. Then there are uh, some key functions of an infection prevention program. So, for example, um, we have surveillance. So, continuous monitoring of infection rates within the institution helps in early detection and response to potential outbreaks. The second one we have is isolation. So isolation means like isolating patients with transmissible pathogen is critical to preventing the spread of infection to other patients and staff members. Then uh, the third one is outbreak investigation and management. Right. So uh, if we talk about the outbreak investigation and management, so when an outbreak occurs, having a plan in place to quickly manage and contain it is like very and quickly manage it's very essential. As example, we can say during a norovirus outbreak in a care home, immediate action like isolating affected individual and enhancing sanitation efforts can prevent further spread. Then we have education, so ongoing training and education for staff about infection control practices ensure that everyone is up to date with the latest guidelines and procedures. Then we have employee health, so protecting the health of employees through measures like vaccination program and regular health check. They reduce the risk of infection spreading within the facility. Then we have antimicrobial use management. So monitoring and managing the use of antibiotics within the institution help prevent the development of antibiotic resistant strain of bacteria. Then the seventh one we have is development of infection prevention policies. So these policies provide a framework for consistent and effective infection control practices across the institution. On number 8, we have environmental hygiene. So maintaining a clean environment by regular disinfection of surfaces and proper waste disposal is essential for preventing the spread of infection. Then we have uh, new product evaluation. So if we talk about it is like before introducing new medical devices or products into the care setting, they must be evaluated for their potential to contribute to infection control. So by understanding and implementing these components, we can reduce the risk of infections in healthcare settings. So thereby protecting both those who receive and those who provide the care. Right. So here we need to discuss about different legislation. So the first one we have here in the list is Health and Safety at Work Act 1974. So this act is the foundation of all health and safety legislation in the UK and often referred to as the Enabling Act. It promotes the health, safety, and well-being of everyone in the workplace. So if we discuss about some of the important aspects of it, so it established the Health and Safety Executive as a regulatory body overseeing health and safety practices. And it also outlined the duties and responsibilities of employers and employees, such as implementing health and safety policies, including those aimed at infection prevention. So, as an example, a hospital must have written procedures for hand hygiene and the use of protective equipment to ensure that staff and the patients are protected from infection. Then the second one we have is Public Health Control of Disease Act 1984 and as amended by the Health and Social Care Act 2008 and the Public Health Infectious Disease Regulation 1998. So, if you talk about it, so this act focuses on preventing infections and diseases and promoting public health. So, few of the key points related with it is it mandates that certain infections and diseases be reported to allow for effective monitoring and control. It also provides a list of highly infectious diseases that must be managed with specific precaution. Uh, as an example, if there is an outbreak of norovirus in a care home, this law requires it to be reported to public health authorities to prevent further spread. And then we have Food Safety Act 1990, the Food Standard Act 1999, and the Food Hygiene Regulation 2006. Okay, so all these laws govern the safety of food handling to prevent foodborne illnesses. So, few of the important points related with it are the Food Standard Agency was established to oversee food safety practices, and the regulation set out safe working practices for food handling, preparation, cooking, and also serving. So, as an example, in a care home, food must be stored, prepared, and served according to these regulations to avoid contamination and protect residents from foodborne illnesses. Then, next we have Personal Protective Equipment (PPE) at Work Regulation 1992. So, and also one important thing in your assignment, whenever you are working on your assignment, please, whenever you are mentioning any specific legislation, then we also need to mention the year as well. So we will always mention the regulation with the year which we are referring to. So like in all these examples, if you notice the year is mentioned, so we always need to make sure that whenever we are referring them in our assignment, so we need to mention the year as well, not only the name of it. Uh, then, okay, we were discussing about personal protective equipment. So, uh, uh, and the purpose. So, if we talk about its purpose, so these regulations ensure that employers provide the PPE, personal protective equipment, to employees to protect them from infection. And few of the key points are employers must provide PPE free of charge and ensure that it is properly maintained and used. Then we have also employee must be trained in the correct use of PPE and comply with its uses as per their employer's guideline. So, for example, nurses working with patients who have infectious diseases must be provided with gloves, masks, and gowns to protect both themselves and the patient. Then we have Workplace Health, Safety, and Welfare Regulations 1992. So these regulations ensure that the workplace are safe environment with particular attention to cleanliness and hygiene. The important points are employers must ensure that the environment is clean and free from risk and that could lead to infection. And this also include regular cleaning and maintenance of equipment used in care. As an example, regular cleaning of patient room and common areas in a hospital is mandated by these regulations to reduce the risk of infection. Then we have Management of Health and Safety at Work Regulation 1999. So the purpose is the regulation requires employers to assess and manage risks to health and safety, including risk from infectious pathogens. And the key points are employers must carry out risk assessment and implement measures to control identified risks. Then the second one is employers are also required to follow safety protocols to protect themselves and others. As an example, in a care setting, regular risk assessment might identify the need for more frequent hand hygiene stations to reduce the spread of infection. Right. So now we have to discuss about control of substances, hazardous to health regulation, 2002. So the purpose is the regulations are aimed at managing the risk associated with hazardous substances, which can include harmful pathogens that cause infections and diseases. Um, the key points are employers and employees are required to manage the risk by using, storing, and disposing of hazardous substances safely. For example, cleaning agents used to destroy harmful pathogens must be handled with care to avoid exposure that could lead to health issues like respiratory problem or skin irritation. So, in a healthcare setting, when using bleach or other strong disinfectant, staff must follow the guidelines to ensure they are not exposed to harmful fumes or accidental spills that could cause injury. Then we have environment protection. So, it's Duty of Care Regulation 1991 and it's amended in 2003. So the purpose is these regulations focus on the safe disposal of controlled waste, which is crucial in preventing environmental contamination and potential public health risk. A few of the key points are the they require that controlled waste, such as medical waste, is stored safely and while awaiting disposable. So we need to make sure that medical waste is stored safely while awaiting disposable. Then disposal. Sorry. Then mm, we can say that this is important to ensure that harmful waste does not become a source of infection before it is properly disposed of. For example, in a care home, uh, mm, like used medical supplies such as gloves and masks must be stored in designated waste container that are secure and clearly marked to prevent accidental contact or environmental contamination. Uh, then we have hazardous waste inland and whale regulation 2005. So these regulations provide guidelines for the safe disposal of hazardous waste, which include materials that could potentially cause harm through infection. So some of the key points are specific practices must be followed when disposing of hazardous waste like used dressing, sharp, and other medical waste to prevent the spread of infection. So, for example, used needles and syringe should be disposed of in sharps container, which are then safely like incinerated to prevent any risk of infection transmission. Then we have, right, then we have Health and Social Care Act 2008, uh, Code of Practices on the Prevention and Control of Infectious and Related Guidance 2015. So, um, uh, this code of practice is a comprehensive framework for infection prevention and control in the NHS and all healthcare providers in England. So, few of the key points are it outlines how providers must comply with infection prevention requirements to maintain high levels of cleanliness. It requires providers to meet standard for assessing, preventing, detecting, and controlling the spread of infections, including those acquired in healthcare setting. As an example, a hospital must implement and regularly review infection control procedures such as regular hand hygiene audit and staff training session to ensure compliance with these standards. Then we have reporting of injuries, diseases, and dangerous occurrences regulation 2013. So uh, these regulations require employers to report and keep record of work-related accident, diseases, and dangerous occurrences. Few of the key points are uh, mm, this includes reporting injuries that lead to death or serious injury, work-related illnesses, and incident that could cause harm, known as dangerous occurrences. For also for infection control, this means reporting any work-related diseases caused by exposure to pathogens such as hepatitis or TB. Uh, as an example, if a healthcare worker contracts an infection like TB due to exposure at work, this must be reported under RIDOR to the health and safety executive, and ensuring that proper investigation and preventive measures can be implemented. These all are the important regulations. Now we need to discuss how can you stop infection. So there are few things which we can do at home. So like the first one here is perform hand hygiene. So this one is a biggie. It's one of the most effective ways to prevent the spread of germs. Um, if you think of our hand as a little germ magnets, they touch all sort of things throughout the day, like doorknobs, excuse me, phones, and even our face. So how do we make sure that those germs don't spread? We wash our hand. So when to wash, so the best thing to do is wash our hand frequently, especially after using the bathroom, before eating, and after touching our face or mouth. So we all know that how to wash our hand. So there are some of the basics, like we need to wet our hand, use warm running water. Then we need to apply soap to our hand and lather it up for at least 20 seconds. Then we have to scrub. So like we need to scrub under our fingernails, between our fingers and all over our hand. Then we need to rinse, and then we need to dry our hand with a clean towel or let them air dry as well. So the next one is we need to uh, keep up to date with our immunization. So immunization or vaccines are like little superheroes that protect our body from harmful diseases. And we can think of them as tiny soldiers that fight off germs before they even have a chance to make you sick. So why immunization is important? They help our body build up its defense system, making it tougher to get sick. It's like giving our body training program to fight off infection. Then we have uh, patient. We have cough and sneeze equity. Right. So, like after COVID, it's like we all try to follow these equities. So, like when we sneeze or cough, um, we release tiny droplets of mucus or saliva into the air. So these droplets can carry germs that can make other people sick. So we need to mm, uh, keep those germs from spreading. So what we do normally is we cover our mouth and nose, and we also use tissue. Then we wash our hand. So as an example, if we are in library studying, so suddenly if we feel like a tickle in our throat, so what we do is we always try to grab a tissue or cuff into it and throw it away. So we are uh, fighting with the germs. Then what we have, clean surfaces regularly. So we need to clean the surfaces regularly, and what we use, sometimes we use disinfectant cleaner that's safe for the surface you are cleaning, and by cleaning the surfaces regularly, especially in high traffic areas, so uh, it could stop the spread of infection. Then we have, keep unwell children at home as much as possible. So uh, we can say that this one is especially important. If our child is sick, it's best to keep them at home so they don't spread their germs to other. And also rest is best, and we can talk to the doctor as well. So uh, now we need to discuss about some other methods include. So these are breaking the chain of infection. So we discussed this earlier as well. There are six steps in it. So like the first one was pathogen. So these are the microorganisms that cause the infection. Then we have reservoir. So so these the reservoir could be a person, an animal, or even in the environment. Then we have a portal of exit. So, this is how the germ escape the reservoir. For example, it could be through coughing, sneezing, or even from an open wound. Then we have the mode of transmission. So this is how the germs get from one person to another. It could be through the air, through direct contact, or even through contaminated surfaces. Then we have portal of entry. So this is how the germs enters a new person body. It could be through their nose, mouth, or even an open wound. Then we have the person who gets sick. So in this, we can say this is the person who is vulnerable to infection. Their immune system might be weak, or they might not have been vaccinated. So for breaking the chain, um, we need to do our duty properly. Then we have exclusion period. Explain. Okay. So if we talk about exclusion period, so it's a period of time when a sick person needs to stay away from other people to prevent the spread of infection. So um, why are exclusion period important? So they help to stop the spread of infection by reducing the chances of sick people passing their germs to others. Then, if we talk about the exclusion period, so who needs an exclusion period? People with certain infections like the flu, chickenpox, or hand or uh, foot and mouth diseases. So often they need an exclusion period. So Also, how long is an exclusion period? So it depends upon the infection. And um then, as an example, if we imagine about a friend who has chicken pox, so for example, the doctors tell them to stay home for a week to prevent the spread of the virus. So this is an exclusion period. It helps to keep other kids from getting sick or any other people. Then we have, right, we have to discuss about controlling the spread of infection. So um, we talk about controlling the spread of infection control precaution. Uh, we have standard infection control precautions. So uh, they are like our everyday, like we can say that uh, they are like heroes when it comes to preventing the spread of infection. They are the basic rules we follow to protect ourselves and other. Whether we know someone is sick or not, it's like being prepared for everything. So why the SICP is important? So they are important uh, in protecting everyone from germs. And who use the SICP? So everyone working in healthcare setting, whether they are nurses, doctor, cleaner, or anyone who comes in contact with the service user, patient, or their belonging, should use the SICPs. And if we talk about some basic IPC measures, so uh, it include hand hygiene, and it also include uh, like the procedure. For example, if we talk about hand hygiene, so we should know when to wash our hand, and the important points in that are before and after caring for any service user or patient, before and after handling food, after using the bathroom, after touching contaminated surfaces, after blowing our nose, coughing, or sneezing. Then uh, we have mm, personal protective equipment. Right. So again, these are the tools that protect us from direct contact with germs. We use gloves, gown, mask, and eye protection sometime as well. Then we have safe management of care equipment. So it involves treating equipment used for patient with care. We do the cleaning. We clean the equipment regularly and thoroughly using appropriate disinfectant. Um, we also do the disinfection. We also do the sterilization as well. Then we have safe management of environment. So it include keeping the environment clean is key to preventing the spread of germs. It includes cleaning and also waste management as well. Then we have management of laundry. So how we handle laundry can also affect infection control. So we need to separate laundry, separate contaminated laundry from clean laundry as well. Uh, Then we have to wash the laundry properly. So we need to use hot and appropriate detergent to kill the germs. Then we have management of blood and body fluid spills. So spills are potential source of infection, so we need to handle them carefully. We need to clean up spills immediately, and we need to use the appropriate cleaning materials such as bleach solution to disinfect the area. And we need to wear gloves and other PPE as well. We need to look for the Waste management. So properly disposing of waste is important to infection control. We need to use the designated containers and we need to follow the guidelines as well. Then we have management of exposure. So in case of exposure to blood or body fluids, immediate action is needed. For example, we need to report the exposure and we need to follow the guidelines. Right. And the next one we need to explain how to reduce the spread of infection. So reducing the spread of infection involves to we need when we adhere to the best practices in hygiene and safety. So first one is hand hygiene. So we need to always wash our hand before and after work and before uh, and after activities like supporting individual with personal hygiene. For example, washing hand after helping a patient or a service user use the toilet can prevent the spread of harmful bacteria. Then we have mm, then we have personal protective equipment. So we need to use and dispose of PPE correctly. For example, wearing gloves that fit properly prevents them from tearing or exposing uh, ourselves or others to infection. We also need to consider that um, when we clean the environment, so like there should be some cleaning schedules and safely disposing of waste as well. Then, last, so also they are telling us that we don't wear jewelry such as ring and watches while carrying out activities such as supporting individuals with their personal hygiene. Right. So the next one is personal protective equipment. So if we talk about PPE, so it's crucial for protecting both health and social care workers and the individual they support. So again, we have the correct usage. PPE should only be used and disposed of in ways you have been trained to do. For example, gloves should be removed without touching the outside to avoid contamination. Then we need to look for the proper fit. We need to make sure that the PPE fits properly. Gloves that are too small might rip, while gloves that are too big could slip off, and both of which increase the risk of infection. Then the correct type. So we need to use the appropriate PPE for the task. For example, color-coded gloves are used to differentiate between handling food and supporting personal hygiene. Then we have cleaning the environment. So we need to maintain a clean environment is very important in infection control. So we need to follow cleaning schedules. So regular cleaning help keep the environment free from dust, dirt, and which can harbor pathogens. For example, daily cleaning of floors and surfaces in uh, service user or patient areas reduces the risk of infection. Then we have safe waste disposable. So proper disposable of waste, such as using designated bins for different type of waste, prevent the spread of infection. For example, clinical waste should be disposed of in yellow bags for infection. And then we have to use the PPE. So always we need to wear the PPE when cleaning to protect ourselves from coming into contact with harmful pathogen. For example, wearing gloves when handling cleaning products. What it does, it protects our skin from harsh chemical and potential contaminants. Then we have cleaning spillages. Right. So, handling spillages properly is important to preventing the spread of infection. We need to undergo training. So, only clean spillages if you have been trained to do so. For example, knowing how to safely clean up a spill of body fluid can prevent exposure to uh, bloodborne pathogen. And again, we need to use the PPE. We always wear PPE when cleaning spillage to protect ourselves. For example, gloves and aprons should be worn when cleaning up vomit to prevent contamination. Then we have uh, the use of appropriate materials. So use cleaning materials that are appropriate for the type of spillage and surface involved. For example, using a disinfectant suitable for wood floors, and what it does, it ensures effective cleaning without damaging the surface as well. So then the next one we have cleaning bodily fluids. So um, when we talk about cleaning bodily fluids, so it requires um, careful attention to prevent infection. We have training, so we only need to clean bodily fluids if we are trained to do so. For example, cleaning blood spills require knowledge of appropriate disinfectant and disposal method as well. And we also need to take immediate action. So clean bodily fluid as soon as possible to minimize the risk of infection spreading. For example, promptly cleaning up urine help prevent the spread of bacteria. Then also we need to consider proper disposable. So we need to use the appropriate disposable method for different type of waste, such as uh, different bags. And so these practices help ensure that bodily fluids are handled safely, reducing the risk of infection. And what we have next, safe handling and disposing of waste. So we first need to identify the waste type. So before disposable, we need to identify the type of waste to ensure it's handled correctly. For example, journal waste like paper, uh, like goes into the designated bin, or like we have clinical waste. So we should always look for the appropriate bag for it. And then we have PPE and hand hygiene. Mm. So we always wear PPE and practice hand hygiene when handling waste to protect ourselves from potential contaminants. Also, we have safe handling and disposal of sharps. So handling sharps such as needle require special precaution. So again, there are training. So only handle sharps if we have been trained to do so. For example, proper techniques for handling needle reduces the risk of needle stick injuries. And we have minimal handling as well. So we need to avoid overhandling shafts to minimize the risk of injury. For example, dispose of needle directly into a sharp container after use to prevent accidental pricks. Right. Then we have to analyze how an outbreak of infection would be managed in a health and social care setting. Okay. So here they have given us a scenario. Right. So if we talk about it, so managing an outbreak of infection, especially in setting like care home, require careful planning and swift action as well. So the scenario they have given us is the COVID-19 pandemic highlighted the importance of infection control in care home, where vulnerable residents are at risk. So about a third of all COVID-19 fatalities in the UK occurred in care home, underscoring the need for proper infection control measures. So we need to uh, do the outbreak management. So an outbreak in a care home can be life-threatening due to the resident um frail health and compromised immune system. So staff must be trained to detect, prevent, and manage infection to protect the resident. Then we have spread of infection. So infections can spread rapidly in care home through physical contact, shared spaces, or airborne transmission. For example, if one resident contracts the flu, it can quickly spread to others if not managed properly. So these are the important aspects. So the next one is, what is classed as an outbreak? So, an outbreak is defined as when two or more people acquire the same infection from the same source. We have detection management. So, early detection and management are crucial, especially in care home where residents are more vulnerable. For example, if two residents show symptoms of norovirus, so it's vital to act quickly to contain uh, the outbreak. Then we have uh, staff training. So, care home staff must be trained in infection prevention, outbreak detection, and also the management. So, these ensure that the staff can respond effectively to protect residents and prevent the infection from spreading further. Mhm. And we have how are outbreak managed in care homes, right? So, managing outbreak in care homes involve several key steps. So, first one is prevention. So, prevention is the best approach. For example, regular hand washing, wearing protective clothing, and promoting cough etiquette are essential practices to prevent the spread of infection. Then we have mm, preparedness. So all care home staff should be trained and prepared for potential outbreak. For example, understanding the symptoms of common infection and knowing the outbreak plan ensure that everyone is ready to act when necessary. Then we have vaccination. So during high risk periods such as winter, it's recommended that all resident and healthcare workers receive flu vaccination to reduce the risk of outbreak. Uh, right. Then next, what we have, right, we have preparedness. So, as we discussed, that for preparedness, we discussed that all care home staff should be trained. Um, so, we need to understand the symptoms of common infection, and we need to know the outbreak plan. So, also we discuss about the vaccination. We have also outbreak prevention training and preparation. So again, training is a key element. All care home staff need to be trained on the dangers of outbreak, the symptoms of common infection, and the precaution they should take to prevent the spread. And mm, it's like a team effort. So then, then we have um, autumn and winter uh, precaution. So we discussed it earlier, like we need to have the um vaccination and like usually who should get vaccinated, so all individual over 65 as they are more vulnerable to serious complication from the flu, and all health and social care worker who come into contact with the resident should get vaccinated. And why it is important: the flu vaccine help to reduce the risk of individual getting the flu and spreading it to others, so it's like adding another layer of protection. Then we have some additional measures. So in addition to the flu vaccine, there are measures that can that a care home can take during the autumn and winter months to help prevent outbreaks. So these include hand hygiene, respiratory hygiene, and environmental cleaning. Then we have detection, right? So early detection of outbreak is crucial to controlling their spread. So we need to be very vigilant. So care home staff must remain vigilant for signs of infection, as early detection make it easier to contain the outbreak. For example, if two residents develop similar symptom, it's important to notify the care home manager and other relevant uh, people or the staff. So it should be done immediately. Then we have communication. So informing the manager, staff, resident, and their families to ensure that everyone is aware of the situation and can take appropriate precaution. For example, limiting visitors and increasing hygiene measures can help prevent further spread. And what we have next is management. Okay. So once an infection is detected, safe management is essential to control the outbreak. So, for example, we can uh, do suspending the visitors. So, to prevent the infection from spreading to or from visitor, care home may temporarily suspend visitors. And for example, during a flu outbreak, limiting external contact help protect vulnerable residents. Then we have stopping admission and uh, transfer. Uh, so, like in that, we can say that halting new admission and transfers of resident prevent the introduction of new infection or the spread of existing one. So, this measure help contain the outbreak within the current uh, resident. Then we have increased PPE and hygiene. So using more protective equipment and increasing the frequency of cleaning and disinfection are crucial steps. For example, the staff might wear mask and gloves at all time during an outbreak. Then, uh, then we have decontamination. So items touched by infected residents should be thoroughly decontaminated to prevent the spread of pathogen. And the next one we have is ED1. Look, it says here 3D1. So that means this is a distinction criteria. The D means here is distinction. So it's related with the uh, learning outcome 3, and it's a distinction criteria. Hmm. So now we need to assess how risk assessment can contribute to reducing the spread of infection in health and social care setting. So risk assessment are a vital tool in reducing the spread of infection. So we need to define the risk first. So in the context of infection, risk refers to the likelihood that an infection can spread rapidly and cause harm. For example, in a care home, the risk is higher if an infection is not identified quickly or if control measures are not applied. Uh, it has Uh, right. Then it has impact on vulnerable population. So the likelihood of infection spreading is greater among vulnerable individuals, such as those with weakened immune system. For example, elderly residents in care home are more uh, likely to get infections like flu, and so they are more at risk. Then we have risk management. So by identifying potential hazards such as new resident entering the home and implementing controls such as isolation or enhanced hygiene measures, the spread of infection can be minimized. Right. Then we have to discuss about potential risk of infection and reasons for potential risk. So in health and social care environment, we need to understand the potential risk of infection, and it's crucial for maintaining safety and protecting both the individual and for ourselves as well. So the first one here is group living setting. So in group living environment like care home, hospital, or shared housing, infections can spread rapidly because many people are in close contact. So, reason for risk are if one person is infected, they can easily pass the infection to others through coughing, sneezing, or by touching surfaces and equipment that other will use. And for example, a resident with the flu might sneeze uh, on a table, and others who touch that table might then pick up the virus, leading to further spread. Then we have caring for individuals. Uh, right. So caring for individuals who have infection or infectious disease. So there are some potential risks. So direct care for individual with infection involves close contact with them. So it increases the likelihood of exposure to infectious agent. So, when we are supporting any individual with personal hygiene, such as helping them bath or eat, drink, or use the toilet, so caregivers may come into contact with bodily fluid that can carry infection. For example, assisting someone with a cut may expose the caregiver to blood-borne pathogen, which could lead to infection if proper precautions are not taken. Then we have handling waste. So, waste handling can expose individual to harmful pathogen if the waste is contaminated. And why there are reason for risk. So, infectious waste such as used dressing or contaminated material can carry pathogen that can be transferred to those handling the waste. For example, without proper PPE, a caregiver might accidentally touch a contaminated item and then touch their face, leading to an infection. Then we have mm, handling laundry. So laundry handling in care setting involve dealing with soil lines that may be contaminated with bodily fluid, and linens soiled with urine or blood may harbor harmful pathogens. So handling these items without proper protection or proper laundering procedures can lead to the spread of infection. So, for example, if soiled uh, linens are not properly washed, pathogen could remain on the fabric, posing a risk when they are handled again. Then we have handling sharps. So sharps such as needle pose a significant risk due to the potential for needle stick injury. And if a sharp object like a needle is contaminated with a patient's blood, a needle stick injury can introduce harmful pathogen directly into the bloodstream of the caregiver. And for example, sustaining a needle stick injury from a needle used on a patient with hepatitis could transmit the virus to the caregiver. And the last one here is cleaning. So, cleaning activities, particularly in healthcare setting, involve removing dirt and debris from areas that may be contaminated with harmful pathogens. And cleaning requires handling surfaces and material that could be contaminated with infectious agent. So if proper cleaning procedures are not followed, or if the cleaner is not wearing appropriate PPE, they might spread the pathogen rather than remove them. So, for example, using the same cloth to clean multiple surfaces without disinfecting, it could spread contamination. And the next one we have, what is an infection control risk assessment? So, infection control risk assessment are required by law to protect health and safety. Then, the purpose of an infection control risk assessment is to identify and assess hazard or risk in workplace. For example, in a care home, welcoming a new resident poses a risk of introducing infection. Then we have the implementation. So the assessment involve identifying tasks or activities that could introduce or spread infection. We need to evaluate the risk and implementing the precaution. For example, screening of new residents for infectious diseases before they enter the home. Then we have record keeping. So we need to keep thorough and accurate record of every risk assessment, ensure that actions are tracked and improvements can be made as needed. So uh, risk assessment. Risk assessment are a proactive way to prevent the spread of infection by addressing potential risks before they lead to problem. And infection control is a very critical component of health and social care. One of the most effective ways to prevent the spread of infection is through a comprehensive risk assessment process. So, and it has many steps. Uh, right. So here we need to discuss the steps. So we need to we need to identify tasks or activities that carry the risk of introducing or spreading infection. For example, the first step in risk assessment is to pinpoint the specific tasks or activities that might cause a risk infection. So um, this could include anything. Excuse me. So we were discussing about the risk assessment. So this could include anything from administrating injections to cleaning contaminated surfaces. So, for example, in a hospital setting, handling needles after giving an injection is a task that carries a high risk of introducing or spreading infection, especially if the needles are not disposed of correctly. Then we need to identify the people who may be most vulnerable to the spread of infection. So it's essential to identify who is most at risk of contacting the infection. So this typically include a service user or patient with weakened immune system, the elderly, infants, and those with chronic illnesses. So in care home setting, for example, residents who are have chronic health condition like diabetes, so they are more vulnerable to infections uh, mm, such as skin infection or any sort of flu. Then we have to evaluate the risk and implementing precaution and control. So once the risks have been identified, the next step is to evaluate how likely these risks are to occur and what the potential impact might be. So based on the evaluation, appropriate control and precaution should be put in place to minimize the risk. So, for example, if the risk of infection is high during wound dressing changes, so implementing a strict hand hygiene protocol can be using sterile gloves can help mitigate the risk. Then we have keeping through and accurate records of every risk assessment. Right. So documenting each risk assessment is crucial for maintaining a clear and accountable record of the measure taken to prevent infection. So these records also help in reviewing and updating infection control practices as needed. So as an example, in a healthcare facility, keeping detailed record of risk assessment ensured that there is a history of what the risks were identified, what actions were taken, and how effective those actions were. So this is particularly important for audit and in case of infection outbreak investigation. Right here, they have uh, given us a scenario uh, for coronavirus pandemic. And if you click on the link, then you can read the scenario related to it. So if we discuss about the COVID-19 pandemic, so it has, um, we all know that the importance of infection control in health and social care. So there were many challenges. The pandemic has presented many challenges, particularly in care home, where residents are highly vulnerable. Then we have learned some lessons. So the pandemic taught us the importance of preparedness, rapid response, and continuous monitoring to manage outbreak effectively. So these all are the important aspects. Then here we have the references. Then we have the plenary. Again, we need to we need to refer to the ebooks and journals on the Moodle. And if you have any queries, so you can email on learnerwork@ukversity.co.uk. And again, they have mentioned that the submission of assignment to be done on learnerwork@ukversity.co.uk. And the assignment should be submitted after 2 weeks of the completion of the unit and its delivery. So we can conclude the today's lesson. So in today's session, we have covered the essential aspects of infection control in health and social care, uh, understanding the infection. So we have discussed the various type of infection and how they spread. We have discussed about we have explored the practices and procedures that can help reduce the spread of infection, such as hand hygiene, PPE use, and environmental cleaning. We also discuss about outbreak management. So we examine how to manage an outbreak in a care setting and emphasizing the importance of prevention, detection, and swift response. So these were all the important aspects that we have discussed today. And I encourage all of you to make sure to review the ebooks and journals available on Moodle for additional information. And if any one of you have any question, please do ask. If not, then we can finish today's lesson. And again, I'm sorry. Again, I took um, half an hour extra of your time. So because I thought again, we have many slides to cover, and all of these are really important to understand. So that's why I'm sorry I took extra 30 minutes of your time. But I've tried my best to cover everything in proper detail. Any questions, students?
Thank you.
Thank you. Take care, everyone. I'm going to stop the recording and we'll see you tomorrow. Take care. Bye.